medical terms of the respiratory system, or medical terminology in pulmonology. So I have here an image, an anatomy image of the different organs of the respiratory system, but this time it has the combining forms for every single organ. So for example, let's start with the nose. We already know it's naso-rhino. We've mentioned tonsils before, that's tonsillo. And then for the rest of the tonsils, we have the adenoids, adenoido, pharynx, pharyngo for the throat, laryngo for the voice box, tracheo for the windpipe or the trachea, and for the airways that open up to the lungs, that would be your bronchi. Broncho is the combining form. The smallest of the bronchi would be your bronchiole, and the combining form is bronchiolo. And then you finally have your alveolus, which are the air sacs of the lungs. The combining form is alveolo. For the lung itself, it's pulmono, pneumo, which really means air, or pneumono. And then for the blue structure here that you see, that would be the lining of the lungs. That's pleura. One other organ that we see here is the diaphragm, and the combining form for that is phreno. So the function of the respiratory system is for respiration, and that is the transport of oxygen to the body cells. The combining form for oxygen is ox or oxygen. Examples are the ox in hypoxia and the oxygen in deoxygenation. So recall the meanings of your prefixes hypo and de. Hypo means below or decrease. De is to remove or to take away. So this hypoxia is unique. I've said this before. It's not hypoxia. So we drop that O. Again, it doesn't follow any rule. It's better to say hypoxia with one O. So respiration also involves the removal of carbon dioxide, a waste product of cell metabolism, and our combining form for carbon dioxide is capno. So our medical term here is hypercapnia. Hyper is increase, capna is carbon dioxide, and ia is pertaining to. So let's do some combining form exercises. Here are a few more new combining forms. Ortho means straight. I gave you that before. I remember giving orthopedist. Mucus, muco. And blue, we all know that is cyano. Okay. So a word with ortho in it in the respiratory system is orthopnea. So literally that means straight breathing or breathing of straight. But again, we said that the literal meaning is not always the actual definition. So anyway, orthopnea is difficulty of breathing related to posture. So you will see this as patients in the hospital where they struggle if you lay them flat on their bed. They breathe better if they are in an upright, straight position. Next, for muco, we have mucoid. The suffix oid means pertaining to or resembling. Like another one with oid is android. Ander is man and oid is resembling. So resembling a man, like a robot resembles a man, android. Then we have cyan, which is cyanosis, which is the picture you see in this slide. So in this chapter, we have the terms alveolus, the air sacs, bronchus, the airway, pleura, the lining of the lungs. Let's review our plural forms. What do you think is the plural of alveolus or bronchus or pleura? So think about that for a second. I hope you recall your unusual plural forms. So the plural forms are alveoli, bronchi, and pleurae. Let's do some medical word exercises again. So here you see a couple of pictures, but first let's define paralysis of the larynx. So it looks like it has two word parts there. There's a combining vowel O in the middle. That would be laryngoplegia. Plegia is paralysis. Visual examination of the bronchi, like the picture on the left. You see an instrument there entering the mouth, going down the airway all the way to the bronchi. That would be bronchoscopy. And then we have incision of the trachea, as you can see in the image on the right. So incision is tomy. That would be tracheotomy. Okay. All of the suffixes begin with a consonant, which is why we all need the letter O. Here's some more. Paralysis of the diaphragm. We already know plegia for paralysis. Do we remember the combining form for diaphragm? It's phrenoplegia. Disease of the chest. That's easy. Chest is thoraco and disease is pathy. So thoracopathy. Rapid breathing. So pnea, P-N-E-A, is breathing. Rapid is, just like there's a rapid heartbeat, tachy. So tachypnea. More word exercises. Excision of the tonsils, that should be easy. Tonsillectomy. Repair of the nose, rhinoplasty. Specialist of the lungs. Pulmonologist. Swallowing air. Okay, that one is new. Air is aero, A-E-R-O. And swallow is phagia, P-H-A-G-I-A. So if you remember in biology, phagocytosis is to eat or to swallow a cell. So swallowing air is aerophagia. So I hope you're taking notes. Absence of breathing. So breathing again is pnea. We add this prefix A before pnea, and that gives you apnea. And the picture you see on this slide shows you a child with sleep apnea. We are assuming that she has sleep apnea because she has that CPAP machine. So our disease here, our first condition is pulmonary embolism. So an embolus is a foreign object that travels through the bloodstream. You can see in the box image there, there is an embolus in the blood vessel of the pulmonary artery. So that's dangerous because that embolus can travel and can completely block the circulation. Next, we have pneumonia, which is really inflammation of the lungs. Instead of saying pneumonitis, we just say pneumonia. We have the abbreviation COPD for chronic obstructive pulmonary disease, which is by the name itself, chronic, meaning it's long-term, it's progressive. Obstructive, there's an obstruction or a blockage. Pulmonary, in the lungs. So basically there's an obstruction in the pathway of air. So asthma is comes from a Greek word that means short of breath, but we're not going to dissect that term anymore. Just remember asthma. This is a chronic obstructive pulmonary disease where you have inflamed walls of your bronchi, they're swollen, and there's also constriction of the smooth muscle. You see it looks like a garter constricting the airway, and there's also a lot of mucus. So very obstructive disorder. Tuberculosis comes from the name of the bacteria that causes this chronic infection, tuberculosis. Emphysema is another COPD Um, emphysema comes from the Greek word that means puff. Well, anyway, in emphysema, the alveoli, the air sac starts to rupture. So when you look at uh, when you look at the lungs of someone who has emphysema, they're expanded, but they can easily collapse as well. Mr. P presents to the emergency room and is diagnosed with a pulmonary embolism. His chief complaint is that he spits up blood in his sputum. What is this called? Well, blood is heme, or heme or hemo. So we're just looking at the suffix here. Is it logi, tisis, or lysis? Think about that. The medical term for coughing out of blood or spitting out of blood is hemoptysis. It's a common symptom for people with chronic lung disorders. This is a procedure known as endotracheal intubation. So intubate, put a tube inside. Endotracheal, endo inside, trachea inside the trachea or the windpipe. Tracheostomy. Stomy is a suffix that means creation of an artificial opening. Tracheostomy. So we have a few more medical terms here. Atelectasis is a collapse or airless lung. Coryza is acute inflammation of the nasal mucosa. It's also known as rhinitis. It's the medical term for the common cold. Epistaxis is the medical term for a nose bleeding. Although we can call it rhinorrhagia, please drop the N there. That's a typo. I apologize. It's rhinorrhagia, raja bleeding, rhino nose. But we don't even use that term. What we really use is epistaxis. Mechanical ventilation, the ventilator for breathing, a device that provides assistance to a patient who's unable to breathe. Mrs. S presents to the emergency department with cyanosis caused by an obstructive airway. The physician incises the trachea to open it below the blockage and restore breathing. An incision into the trachea is known as, is it tracheocentesis, tracheostenosis, or tracheotomy? I hope you all got that. It's tracheotomy. Thoracentesis. Synthesis, puncture to aspirate fluid. And you can see that in this image right there. Thoracocentesis is also correct. So thoracentesis or thoracocentesis. Bronchodilators. Broncho pertains to the airway. Dilator is something that will open up or dilate a hollow organ. In this case, the bronchi. So I wanted to go back to this slide where we have thoracentesis. As you can see, there is fluid in the pleural cavity and it's being collected. Now, if that's not fluid, if it's blood, then we call that hemothorax. There's blood in the thoracic cavity. And if it's pus, we call that pyothorax. And if it's air occupying the pleura, not allowing the lungs to expand, then we call that pneumothorax because the combining form pneumo really means air.